Hello, and thank you for taking the time to hear about the OMERACT Glucocorticoid workshop for 2020. In this video, we will give you an overview of how we have gotten to a proposed core domain set for measuring the effects of glucocorticoids in clinical trials using OMERACT methodology. For more information about OMERACT and OMERACT methodology, including domain selection, please follow these links. Glucocorticoids come in different forms and with different names. These include steroids, prednisolone, prednisone, hydrocortisone, and dexamethasone, just to name a few. In this video and at the workshop, we will also use the abbreviation GC. Although systemic glucocorticoids have benefits for many people with inflammatory conditions, they also come with adverse effects or side effects, which often go beyond the traditional idea of a medication side effect, such as the impact on people's families, friendships, and work, and the cost of treating any adverse effects. To assess and compare treatment regimes involving glucocorticoids, we need to be able to properly assess their effects. In 2014, the Glucocorticoid Working Group was formed to develop a core set of outcome measures for future clinical trials involving glucocorticoids. The group's progress has been presented and published in 2016 and 2018. Following the OMERACT process, we have been working to develop a core domain set to be presented at the 2020 workshop, which we hope you'll be able to join. In brief, the OMERACT Glucocorticoid Working Group has conducted systematic literature reviews, qualitative studies, and surveyed patients with a range of rheumatological conditions to identify possible outcomes from glucocorticoid use. The working group then conducted a Delphi process to identify the outcomes most important to patients, clinicians, and researchers. From the work conducted, we identified a number of themes. Patients often spoke of the benefits of glucocorticoids in treating the underlying disease and their symptoms. But adverse effects were often reported, particularly weight gain, osteoporosis, psychological effects, sleep disturbance, and skin changes. It was clear that patients balanced the benefits and adverse effects when considering the necessity of glucocorticoids. Patients also often spoke of the difficulty in working out whether an effect was related to the disease or to treatment. In addition to these factors, the distrust of glucocorticoids was evident, including opinions from family, friends, and their clinicians. Combining the results from the systematic literature reviews, survey work, and qualitative interviews, we had 63 candidate outcomes that could be put into 4 categories: physical symptoms, psychological symptoms, participation, and contextual factors. The Glucocorticoid Working Group then sought agreement amongst patients, clinicians, and researchers using a Delphi exercise to identify outcomes important to these groups. After the Delphi process, outcomes that were important to both groups were included in the domain set. The outcomes that were not considered important to measure in clinical trials were removed. Some domains and outcome measures were still highly ranked by patients, clinicians, and researchers, and were found to be important from the prior work, but not meeting OMERACT thresholds for inclusion. So a ranking survey was created to decide on whether the remaining outcomes were important to include in future clinical trials. Where there was agreement between patient and clinician researcher groups indicating that an outcome should be measured in every clinical trial, these were included in the final domain set. After this, we had a group of outcome measures that were important to patients, clinicians, and researchers. When reviewing these measures and considering the previous studies, the working group identified some outcomes that were very rare occur with high-dose glucocorticoid use or with long-term use. As these would not be feasible to measure in all clinical trials, they have been recognised as important but not mandatory for all trials. This is the proposed OMERACT glucocorticoid onion, which will be discussed in more detail at the 2020 virtual workshop. The core domain set will be presented for voting. Thanks again for watching this video, and we hope to see you at the virtual workshop.